My name is Stephanie Cherestal, and I'm a psychologist in New York. I've been a licensed clinical psychologist for about 2 years. JED is a nonprofit that protects the emotional health and prevents suicide for our nation's teens and young adults. Today, I'm here to talk about anxiety disorders. When I talk to teens today about anxiety disorders, I often hear a lot of questions. How do I know if I have an anxiety disorder? How do I get help if I do have an anxiety disorder? And so here, I'm going to be talking about some answers to those questions. Anxiety and fear is a normal part of life. Every human being on this planet experiences fear, and that is a normal emotion to have, and that it actually serves a purpose. It protects us from danger and threats. Anxiety, similarly, is something that comes up for us when we anticipate a future threat, and it is perfectly normal and typical to experience anxiety. So for example, if I have this anxiety about failing an exam in the future, that can actually be helpful in the sense that it motivates me to study, which for most people isn't fun to do, but it motivates to engage in that behavior. So anxiety can actually be a really helpful thing to experience in a lot of senses. Anxiety becomes a problem when it sticks around in a way that's difficult to control, and it lasts and lasts and lasts. When it leads us to avoid certain things that are actually important for us, and when it starts to get in the way of our functioning, maybe at work or with our friends. An anxiety disorder exists when a person experiences chronic fear that sticks around, and it can stick around for a really long time, sometimes 6 months, sometimes longer. And oftentimes the fear and the anxiety that's experienced when you have an anxiety disorder doesn't quite match. It's a little disproportionate to the situation that you're in. It can feel really difficult to control your worrying, and that anxiety that's experienced can really get in the way of functioning in a lot of ways, whether it's in social situations or at work or at school. Anxiety disorders really make it difficult to function because of that level of anxiety. There are a number of different kinds of anxiety disorders, many different kinds. Anxiety disorders really differ from one another based on the object or situations that create that anxiety. It gets a little tricky because sometimes people can have different sorts of anxiety disorders at the same time, but really an anxiety disorder is diagnosed based on the situations that bring out that fear and anxiety. So for example, a specific phobia is one kind of an anxiety disorder where a person experiences anxiety or fear around a specific object or a specific situation, something like spiders or a fear of flying. And that level of fear is not quite proportional. It doesn't quite match the dangerousness of that situation. And a person with a specific phobia would frequently avoid that situation or object that brings out that fear in a way that can get in the way of that person's functioning. Another anxiety disorder is social anxiety disorder. So a person who has social anxiety disorder oftentimes experiences a lot of anxiety in social situations. And that might involve going to parties or meeting new people or even sometimes having one-on-one conversations with people. A person who has social anxiety disorder might then avoid a lot of situations that involve meeting other people or these sort of social situations. They might avoid things like parties or getting to know new people, or might even use substances like alcohol to help tolerate that anxiety in social situations. That can be incredibly common, and I hear that quite often. Another kind of anxiety disorder is panic disorder. So a person who has panic disorder experiences frequent and sometimes unexpected panic attacks, these intense rushes of fear. And a person who has panic disorder also has this constant worry of having future panic attacks in the future. So a person with panic disorder is often like scanning or just observing feelings in their body, looking for signs that a panic attack is going to be coming at us. And a person with panic disorder often will avoid situations that might bring on feelings that become a signal that a panic attack might be coming. So avoiding things like exercise or caffeinated beverages, because that is something that can bring up the heart rate, and then for someone who has panic disorder can lead to a lot of fear that they're about to have a panic attack. So it's very common for people who have panic disorders for their behavior to be changed and shaped in a lot of ways to prevent the possibility of panic attacks. Another anxiety disorder that's incredibly common is generalized anxiety disorder. So a person who has generalized anxiety disorder experiences a lot of worry in a lot of situations. So that might be worry about how we're performing at school or at work, or how my health is or the health of my loved ones. And that worry can be incredibly difficult to control. That person can feel restless and on edge, fidgety, have difficulty concentrating or getting to sleep, appear irritable or tense very often. And again, that anxiety can really get in the way of that person's functioning in a lot of situations. So it's important to know that there are many different kinds of anxiety disorders, which are different than the typical feelings of fear and anxiety that most people experience from time to time. It's important to know the difference between typical fear and anxiety versus an anxiety disorder to know when you might need some treatment. If you're experiencing anxiety that feels like you can't control it, that it sticks around, that it feels chronic, that it's maybe lasting for weeks or for months, that it's getting in the way of you functioning, maybe it's causing you to avoid certain things that actually you really want to engage in, it can be really helpful to pay attention to those signs and to seek help for your anxiety. The therapies that exist, the treatments that exist for anxiety disorders are incredibly effective. So there is strong reason to have hope that with treatment, a good treatment that's the right fit for you, that your anxiety will get better.